Good evening. It is my honor to take part in this wonderful event to celebrate the 2021 recipients of the Asia Game Changer West Awards. Through excellence in the sciences and the arts, these four have made such a difference to people in their local communities, Asia, and throughout the world. This evening's honorees are an inspiration, and it is my privilege and delight to introduce to you Dr. Grace Lee. As COVID-19 quickly spread across the nation, Grace provided crucial guidance and counsel, helping officials at every level navigate the ethical and medical priorities at stake with vaccines and immunization efforts. An advisor to the Centers for Disease Control, an Associate Chief Medical Officer for Practice Innovation for Stanford Children's Health, Grace has had particular impact in the areas of access and equity. Grace has also been a trusted voice and has helped millions of people navigate the uncertainty of the pandemic. Through media appearances, conference talks, and one-on-one conversations, she has made scientific concepts accessible, while answering important questions about children's wellness, vaccine safety, and other critical topics. Through her expertise, dedication, and compassion, Grace has saved countless lives and has helped millions make informed decisions that have kept themselves and their families healthy. On behalf of Stanford Medicine, I want to extend my heartfelt congratulations to you, Grace, and a sincere thank you for your incredible work, especially during this unprecedented public health crisis.
Thank you so much. I am so honored to accept this award and to join this distinguished panel of current and former recipients of the Asia Game Changer West Awards. A special thanks to Dean Lloyd Minor for his sponsorship and support of this nomination, and to the Asia Society Northern California leadership team for putting together this wonderful celebration. Receiving an award like this makes me reflect on the events of the past year. A year ago, I was leading our local response to the COVID-19 pandemic and supporting our healthcare workforce, our patients, and our families through a period of tremendous uncertainty as the pandemic unfolded. Leadership in that moment was an experience in humility. We had to be open and transparent about what we did and did not know, and to focus on caring for those around us who were fearful of the risks of working with sick patients. As the year went on, I've had the tremendous privilege to support vaccine decision-making as a member of the US ACIP Advisory Committee on Immunization Practices. In order to support the public health response, it's been critical for the ACIP to ensure public confidence in vaccines by transparently discussing the efficacy and safety of each vaccine authorized for use, even as we continue to learn in real time. The other aspect of serving on ACIP that I have come to appreciate is the ability to give voice to those who may not always be heard. The pandemic has disproportionately impacted communities of color, those living in congregate settings, people with disabilities, and our essential workforce. I've really appreciated the central importance of equity in designing our national, state, and local response to the pandemic, and I'm personally committed to continuing to serve as a voice for equity going forward. But perhaps the hardest part of this pandemic for me personally has been the anti-Asian attacks we've witnessed in recent months. The people being attacked are our parents, our grandparents, our sisters, and our brothers. Knowing that the Asia Society is actively addressing this issue and supporting our community is of tremendous importance. There are countless Asian leaders working in healthcare and in public health who have been working tirelessly to support the public health response to the pandemic in the US and globally. And that is why this award is so meaningful, because it reflects a recognition of the amazing work of so many of my Asian colleagues that they do behind the scenes. While I'm extremely grateful to be recognized for this work, I need to thank a few individuals without whom this would not have been possible. My parents, Hyung-woo Lee and Hee-ja Lee, have taught me through their own examples about the value of service and of community, which has been a guiding principle for me throughout my career. They've worked far harder than I ever did, and they've had to persevere through many more challenges as immigrants to this country. And I would like to thank my husband, Josh, and my two daughters, Naomi and Abby, who are another source of strength and support for me. Even as I struggle myself to lead others through the pandemic, my family keeps me anchored, honest, and focused on what's most important. So thank you again to the Asia Society for this very meaningful recognition.